Hello guys, my name is Isaac Simple and Real. Welcome to my channel. This is a channel where we should talk about issues concerning averting HIV and sexually transmitted infection stigma in our society. And we should say that being positive about HIV is not necessarily being HIV positive. Thank you. Today we are going to talk about tuberculosis. Not about cause, not about transmission, but about how to do TB test on a one-off or using a rapid diagnostic test. I know we have experienced various rapid diagnostic tests like malaria test. We have experienced rapid diagnostic tests like a HIV determined kit test. But now, I know so many people have not come across a diagnostic method of tuberculosis where you use urine as the specimen to test for tuberculosis. Let's learn. Now, basically, when you have tuberculosis or when you are suffering from tuberculosis, be it symptomatic tuberculosis or asymptomatic tuberculosis, that is, you are having tuberculosis but the symptoms have not yet really manifested themselves. Maybe there are some symptoms but maybe it's unclear for a clinician to be able to detect them as symptoms. Like for example, let me give an example of someone who is not heavyweight like me. Maybe I could be losing weight, but because I know myself I'm a lightweight person, I may not consider it as a significant weight loss. Maybe I may attribute it to other causes like maybe I'm not feeding well, or maybe I have stress, or maybe other things. But do you know you could be suffering from actually tuberculosis or active tuberculosis? The other thing is, especially extrapulmonary tuberculosis. Someone having TB retinitis may have it hard, especially to make that diagnosis, especially if the ophthalmologist who is seeing you, or the clinician or the doctor who is seeing you, is not so much experienced, or maybe has never come across such a diagnosis of tuberculosis as such. Or maybe someone who is suffering from TB adenitis. It may be difficult for someone to diagnose. Maybe others may have differentials which may take so long to confirm that diagnosis. Especially for those persons who are immunosuppressed, especially HIV positive persons. It becomes so hard to make such kind of diagnosis, especially considering there could be other opportunistic infections or other differentials that could resemble the same symptoms as those of tuberculosis, extrapulmonary tuberculosis. So in this case, it becomes very difficult to consider TB as one of those differentials. Number two, in scenarios whereby a gene expert turns negative and a chest x-ray is inconclusive, having another test or an antigen test becomes very key in confirming a diagnosis of tuberculosis. Now, what test are we talking about? We are talking about a test called TB-LAM. What is TB-LAM? TB-LAM in full means tuberculosis lipoalbuminoman test or rapid test. How does it work? Basically, the cell wall of TB bacilli or tuberculous bacilli contains a protein called lipoarabinoman. This when the bacteria dies, or as the bacteria grows, this protein is usually released in the blood, and it is usually excreted through the renal system to the urine. Now, how do we use this test to make a diagnosis? Actually, I have that test kit and I'm going to describe it or to demonstrate it right away. Let's learn. This is the kit. The kit looks like this. As you can see here, it says TB LAM, or lipoarabinoman antigen test. This is a government issue, and I'm going to describe it or demonstrate it. Now, the rapid kit looks like this. Usually, this issue does not come with a buffer because of the nature of urine. It is easy for urine to go through this. Now, what do you do? If you have someone who is HIV positive and who is having symptoms suggestive of tuberculosis, or someone who has a CD4 count, cell count of below 200 copies per microliter, this is what you do. You test them for tuberculosis. Now, how do you test for tuberculosis? The golden test for tuberculosis is GeneXpert. But in a scenario whereby the GeneXpert is negative, or maybe they could not be able to get sputum, you'll take their urine either from the urine bag, or you can, if they can be able to pass urine in a bottle, you give them the specimen bottle, and then they collect urine, and then they bring it to you. You only require about 2 drops. Now, this is how you open this thing. You just stretch it like that, and then you will get this edge, as you can see, this. Now, you just open it. After you open it, as you can see, I do not wish to open it because I'm not using it right away. But for the purpose of learning, let's open it. So, I've just opened it like that. Now, as you can see, we have different spots. We have this is where you lodge 2 drops of urine, and then this is the control phase, and this is where you check your results. Now, if the results, you see one line here and a blank here, it means that person is negative for TB. Number 2, if you see a single line here and another single line here, it means that person is positive for tuberculosis. Number 3, if you see a single line here and no line here at the end, it means that person, that result is inconclusive or invalid. So that is how we check for this kit. Now, what is the procedure of doing this? Let's go to the start. Step 1, let the patient collect urine. Step 2, take 2 drops of urine and drop them at this edge. Step 3. Observe as the kit or as the urine flows towards the control point for at least 20 minutes. So you are observing this thing for at least 20 minutes. After 20 minutes, observe the results. What do you expect? The 3 things that I've said. You first and foremost, check for control. If you can see control, then the results are valid. Number 2, check this point. Do you see single line? Positive. Do you see no line? Negative. Are we together up to this point? Thank you. Now, this is the easiest way for you to make a diagnosis of tuberculosis. Please note that having a negative TB lump does not conclusively rule out the presence of active tuberculosis. Are we together up to this point? Thank you. So it is very important, if this is negative, please consider doing other tests, which include taking biopsy or FNA for lymph nodes, or you can consider taking a CSF when you are suspecting a TB meningitis, or any other recommended specimen necessary for confirming a diagnosis of tuberculosis. And with that, guys, thank you and God bless you. If you have not yet subscribed to my channel, please subscribe, like and share. My name is Isaac, simple and real. Thank you for watching. Goodbye.